My name is Sharon Sande. I'm a nurse midwife at Jacaranda Maternity, Umoja branch. Today we want to talk about understanding early signs of pregnancy. So our first question is, what are the first signs of pregnancy? So for the signs of pregnancy, they are normally divided into three. So number one, we have the possible signs that you're pregnant. So this mostly normally happens. They are the things that the clients normally come with. They report. So the client might report amenorrhea. Amenorrhea is where you miss your periods. Like the period doesn't come. They normally come with morning sickness. They come with breast tenderness. They come with frequent urination, or we call it bladder irritability. Those are like the possible signs that you're pregnant. Okay, the second category is the suggestive signs. These things that they might suggest that you're pregnant. The suggestive signs are presence of, we call them the HCG hormones. These are hormones of pregnancy, mostly on the strips. The other is evidence of uterus growth, uterine contraction, or ballot movement. Sometimes you might feel like there's something moving in the tummy. So those are the suggestive signs that you're pregnant. So we have the positive confirmatory test, which are mostly visualization of the fetus using the scan, feeling of the fetal parts by physical examination, where the tummy is being touched. And then the other one is through presence of fetal movement, or the being heard of the fetal heartbeat. The other one, how early can pregnancy symptoms start? So with early pregnancy, it normally depends with each and every individual, but mostly the pregnancy symptoms normally start after implantation. That is always 3 weeks after fertilization. So some mothers normally, it depends with each and every individual, but most people normally start the symptoms after 3 weeks, that is after implantation. But some get the symptoms, some doesn't get the symptoms. So it depends with each and every individual. The next thing is spotting normal in pregnancy. Spotting is not normal in pregnancy. Spotting can suggest a lot of things. So the moment you see any spot, you need to go to seek immediate or urgent medical attention. Because spotting might be a sign of implantation. Spotting might be a sign of the sexually transmitted infection, or spotting might be a sign of maybe after pregnancy, there's normally a changes on the cervix. So normally, some people normally say, how can I know that is it's an implantation spot, not a bleeding spot? So implantation spot, number one, you can identify with the color. So sometimes there's difference between implantation spot and maybe the period spot. So the implantation spot, sometimes the color is either brownish or pinkish. It's normally like a spot. It's a spot of blood. And then it might take hours or 1 to 2 days. The period, with spotting, it has a light cramp. The periods normally comes with like a heavy cramp with a bright red. It might last 4 to 7 days. So be it the spotting of implantation, be it the spotting of period, the moment you realize that you're spotting pregnancy, you need to seek immediate medical attention. The next question is, when should I visit the hospital? Immediately you find out that you're pregnant. Nowadays, we don't even wait that you find out that you're pregnant. Immediate you want to conceive, you are always advised to go to the hospital. There's a lot of things that always need to be done in the hospital. So the moment you find out that you're pregnant, you need to visit immediate to the hospital. There are a lot of blood works that we normally do, like your ratios. We screen the urine, mostly urine we screen to detect things like bacterial infection, the urinary tract infection, the gestational diabetic, the protein, those high blood pressure, eclampsia during pregnancy. We look for your blood group, maybe the ratios incompatibility. We do screening of the sexually transmitted infection, which is always very, very important, because normally you find some sexually transmitted infections are placental yak, they can cross the placenta, they can harm the baby. So the moment you find out you're pregnant, you need immediately seek medical attention. Okay, the other things is, are home pregnant care accurate? Some may be accurate, some may not be, because the way we are doing it, some other people, and then sometimes you might find the strip is positive and you're not pregnant. So the moment you find out that the home pregnancy test is positive, the first thing you need to seek medical attention, because sometimes there's maybe other condition that can cause a positive strip. So the moment you find a positive strip, you need to come to the hospital immediately for a confirmation. Okay. The other thing is, when should I start my NC clinic? So we've said that immediately you find out that you're pregnant, you need to come to the hospital. During the hospital, we can repeat a pregnancy test strip, or we can do a scan. We call it a viability scan. The first scan, it's always very important, because that first scan normally shows us viability of that baby. It shows us where the baby is implanted. Also, it can help us to rule things like ectopic pregnancies, and it also normally help us to rule things like maybe it's like bilateral ovum, things like that. So the moment you find out that you're pregnant, you need to immediately come to the hospital. And then the importance of coming early to the hospital will start you with folic acid. During the early pregnancy, the first 3 months, which is from month 1, from week 1 to week 13, we normally advise you guys at least you take folic acid, because the first 3 months is where the most organs of the major organs of the baby is formed. There's DNA formation. So folic acid normally help us to prevent those, we call them the neural tubal defects. These are abnormalities that baby normally get them during the formation, the growth and development. So we normally advise you to at least take your folic acid. Those abnormalities, mostly we call them the neural tubal defects, like spinal issues, or sometimes you might find babies with cleft palate. So the first medication for a pregnant woman to start is folic acid. Okay. So we want to talk about symptoms of pregnancy. So number 1 symptoms is always nausea and vomiting, which is always the worst thing. For nausea and vomiting, it's normal. It's normally, most of them normally last from week 1 to 13th week, the first 3 months. So some people normally get like mild nausea, but if it's come to the severe one where you vomit like everything, that normally needs urgent medical attention, because sometimes it can cause electrolyte imbalance. So some people normally even end up to be admitted for some antiemetics. These are drugs that normally control the nausea. But the moment that nausea is mild, with mild nausea it can be manageable. So the moment you're experiencing maybe nausea in the morning, the first thing, if you wake up, do not brush your teeth. The moment you brush in the morning, you'll vomit. And then you are always advised at least take small frequent meals. It normally helps to curb the vomiting. Your start meal should be at least the cracked food, the crackers. Mostly you normally advise at least ginger, foods that contain ginger. Ginger normally at least help us with nausea. And then the other thing with nausea, just know it's normal. It's because of hormones. It just vanishes with time. So the moment it comes severe, please always seek immediate or urgent medical attention. Some people normally have sore or tender breasts. It's normal, also because of the change of hormones. So at least with tender breasts or breast enlargement, so you normally advise at least wear an enlarged bra. Usivae bra yenye inakufinya. Okay, and then at least you're always also advised to avoid soap on the darkening part of the breast. It normally causes them to crack because they are tender. So at least wear a supportive bra. Some people might experience acne, which is normal. This is caused by also increased hormonal in the body, normally increased oil, mostly in the body, in the face. So the increased oil normally was zinaziba the pores. So zikiziba the pores, that is where acne normally comes, but it also depends with each and every individual. The other symptoms of pregnancy we've called morning sickness, and then so there is some question which has been asked. So is it normal kupata period 4 weeks after delivery? So it's with periods after delivery, it's normal, but it depends with each and every individual too. But mostly you normally find out that most people get their period from 4 to 6 weeks, so which is normal. But note that some mothers can fail to see their periods up to 6 months of exclusive breastfeeding, which is also normal. So each and every individual, it's unique on their own way. So mostly period normally start from 4 to 6 weeks after delivery, because the hormones have already started balancing. That's why we normally encourage you from 6 weeks after delivery, at least you can start consultation, things like family planning. So it's very normal. And then the next question, mtoi wangu anacheza nikiwa nimekaa chini, nikilala hachezi, shida ni nini? With movements of the baby, it normally depends. They have patterns. Okay? Mtoi wangu anacheza nikikuwa chini. Mostly, it depends with each and every baby. They have their own patterns. You find there are some baby who normally plays, maybe ukikunywa kitu, maybe ukikaa, maybe ukilala. Some baby normally wanacheza, mtu anasema mtoto wangu anacheza usiku sana, mchana achezi. The most important thing is lazima mtoto acheze. That is the most important things. For the movement of the baby, this is the ni kazi ya mama. You are the only person who know the patterns of your baby. So the most important things, you normally have to track your baby's pattern. Because if you know that maybe iyo chini akikandi anacheza sana, sometimes unasemanga maybe hatukwangi busy sana, you can just take the most time yenye baby anachezanga, just take 2 hours. Mtik-tik, jaribu kumtik-tik. If it's more than 10 times in 2 hours, time yenye ako active, that baby is okay. So it depends with each and every individual. So if you akicheza sana ka umeka, the most important things ni mtoto anacheza throughout, and you know the pattern. Yenye the moment that pattern imechange, unafaa kukua error zikwe high. Because unajua tu hapana, venye nimemzoea, because that is the way umemzoea. The next question is, how does one know pregnancy? How for long after finding out? So it depends. Like I've said, mostly you normally find implantation normally starts at 3 weeks. So most symptoms normally shows up after implantation. That is 3 weeks from fertilization. So also it depends with each and every individual. There's some people who might start immediately after implantation. There's some people who might start showing the symptoms 2 weeks after implantation. There are people who doesn't totally show that they're pregnant. The symptoms, the signs are totally not there. So it also depends with each and every individual. Okay, the other question is, nikifanya any light call like mopping or vyombo, naweza kuspot shida ni nini? Just know we've said spotting is a danger sign. The moment you spot, regardless kama ni gani ama uambiwe sijui mwenzaka amekwambia hiyo ni implantation, the moment you use anything red, as long as you're pregnant, it's danger sign. So the moment you see any spotting, you immediately go to the hospital. Because we said spotting, yes, can be implantation, but for you don't know. Spotting can be maybe those urinary tract infection or the sexually transmitted infection. Spotting might be a sign of miscarriage also. So and then the other fourth, spotting can be because of changes of the cervix. So the moment you see any spotting, you need to come to the hospital. Mostly during pregnancy, we don't allow heavy work. You need to do more of resting.
you are advised at least do regular non-strenuous. You don't need to do anything straining because it will be bad for the baby. Okay, so maybe light mopping is training, light core mopping is training, mopping is not light. So just know any straining exercises during pregnancy, it's not advised. Mostly those cores that normally involve our back, bending, a lot of bendings, it's not allowed because training can cause by the spotting that is threatening that baby. So the moment you've seen any spotting sign, don't hesitate to come to the hospital. Regardless which kind of spot is, anything red, be it brownish, come to the hospital. And then the other thing, nafaa kuanza clinic akiwa how far long. So we've said the moment you're pregnant, you need to come to the hospital. The moment you find out that you're pregnant, you need to come to the hospital. We've talked about the blood works. We've talked about the medication, the folic acid. You need to start them immediately. We need to do we call them your antenatal profile. The blood group, we need to know your blood group. You need to know your HB level. The HB level is the amount of blood in your body. We need to know we screen the urine to screen things like bacterial infection. We need to screen like the diabetics in pregnancy, the high blood pressure in pregnancy. So the moment you find out they're pregnant, immediately just come to the hospital. So there's another question. I'm 38 plus 6 days and I'm feeling pain kwa mgongo. What could be the issue? 38 plus 6 days, that is your term. So what normally determines that your term? So you normally find out that in that your booklet there's an EDD. EDD is an estimated date of delivery. So we normally say EDD is when you reach 40 weeks. It can be either plus or minus 2 weeks. So the moment, if we minus the 2 from 40, that is 38 weeks. So meaning 38 weeks your term. You are approaching labor. So there is signs of approaching labor. Like the body is preparing itself for labor. So while approaching labor, you might feel some dull back pain, cramping, which is normal. The moment it comes severe, it's not normal. Something severe like it's a cramping that does not go away. A cramp that normally persists at its goals. But at 38 weeks, once in a while you might feel some period like cramps. They normally come, they goes away. We call them false labor. Because right now the body has started preparing for labor. It's approaching labor. So trust me, you might be feeling the on and off cramping as long as it's not severe. And they normally come for some days and then they just disappear, which is normal. Some people normally feel the pressure pain, the pressure symptoms, which is normal. The inner, the outer thighs pain, those are very normal. So there's some exercises which are normally help to relieve that, which I can't mention here. But there's some exercise that maybe the squats, if you come to a facility, we normally have the birth classes. We can at least explain for you. There's some exercises that normally help to relieve the pain. But the cramping, the dull pains are normal. We call it the inner, the outer thighs pains are normal. So the moment you experience them, it's normal. So when 38 plus 6, the only pain that you should be worried about, lower abdominal pain or cramping like pain or contraction like pain that normally come with frequency and intensity. And they are severe, they doesn't go away. They normally tend to come slowly, but as the time goes, they normally peak with frequency and intensity. So the moment you've seen like a pattern way, you need to come to the hospital. But just know 38 plus 6 days, we are approaching labor. You might feel the signs of approaching labor. If we say the dull pains, sometimes the tightening or hardening of the tummy, call them the Braxton. The Braxton hits, the false labor, they're very normal. The other question, why do I feel pain on the right side of the lower abdomen when pressed? It's normal, it's because of we've said because of the pressure. Mostly from a third trimester, you normally find that the baby's head is down at the pelvic. So the pressure normally feel that pain. Also with the pressure pains, there's some exercise that normally help us to relieve that pressure pains. So about the exercises, okay, I can't do them here, but we normally have special classes. We call them the birth preparedness class. This class normally happens on Thursdays in our Amatu Jacaranda Umoja branch. So these are the birth preparedness class are always very important classes done from 36 weeks to 40 and above. These classes normally help us to know more about labor, the do's, the don'ts during labor, the do's, the don'ts during delivery, how we are supposed to cope with pain. They are very beneficial. At least the moment you attend that birth class, you will have the knowledge and information on about labor and delivery. The other importance of birth preparedness class, there's some exercises that we normally at least teach you from there that will help you to manage the period-like pains at home during labor and delivery during that time. And then they also normally helps labor being more comfortable and more bearable. So I'm a mom of 4, but currently I can't get pregnant. I'm not on any family planning. What could be the issue? So with that one, we normally, a mom of 4. So it depends how long have you tried. But sometimes you might normally find maybe there's some hormonal issues. So with things like that, the first thing you need to come to the hospital. At least we can know the cause. There's some tests that you are normally at least allowed to do. So we need to find the cause first before diagnosis, maybe with things like secondary infertility. But we need to find the cause. So there's some lab tests that are normally done to find the cause at least. Okay, the other question, can one just experience nausea with no vomiting? Yes. We've said with symptoms of early pregnancy, it depends with each and every individual. There's some people who normally just experience nausea. They don't have that urge to vomit. It's still okay. So we've said with nausea, we've seen how we manage it. If it's severe, with severe nausea, there's something called, medically it's called hyperemesis gravidarum, but with that one, it's normally managed in the hospital. Hyperemesis gravidarum is where you vomit everything. There's nothing intake going inside. So sometimes it normally causes electrolyte imbalance, so you need to at least go to the hospital for further investigation to be done. For the minor nausea and vomiting, we've said first, at least you can come to the hospital. We'll be giving you antiemetics. Those are drugs that normally help to curb nausea, like Nozic tablets. At least we've said with nausea, we can manage we eat small frequent meals, we eat at least crackers, we tend to kuongeza hizo mambo na nausea. And then we drink water between meals. We don't drink water with meals. And then for people who normally experience a lot of nausea and vomiting, if you wake up, you need at least to avoid brushing your teeth in the morning. What is the best time to start my cleaning? We've said immediately you find out that you are planning. We call it preconception. The moment you are planning to get pregnant, you just need to visit at least the hospital. There's some medication that you are normally given. You are advised further, as we also. So you need to start even before getting the pregnant. If you're pregnant, you need to start immediately. You need to come to the hospital immediately.
So there is somebody who have asked, can I take any pain reliever when having headaches while pregnant? The moment you're pregnant, you don't need to take any medication. The moment you're pregnant, you need to seek immediate medical attention. So there's these things that we normally call the danger signs in pregnancy. So these are signs that whenever you experience them, you need to seek immediate urgent medical attention. She has talked about the headache. Headache is a danger sign in pregnancy. So the moment you're feeling severe, persistent headaches, that is a danger sign. Any bleeding, any spotting, that is a danger sign. Fainting, fits, those are danger sign. Falling, maybe ulikuwa umeenda mahali, uko na mimba, umeanguka, umeteguka, mtu amekugonga tumbo, kitu imekugonga tumbo, you need to seek immediate medical attention. Persistent dizziness, blurry vision, those are danger signs. Sometimes you normally find those people who normally, they are pregnant, but they are very puffy. The face is swollen, the hand is very swollen. In pregnancy, that is not a good sign. The moment you experience that, you need to seek immediate medical attention. So with severe headache, you don't have to take any medication. Just come immediately. At least it will be to rule out the cause of that headache. The next question, I'm 36 weeks and my HB is 10. Am I in danger? An HB of 10, that is a danger sign. Remember the normal HB level. HB is the amount of blood in the body, is 11.5 to 16. So the moment it's 10, it's danger sign. You need to at least be having those medication that normally help us to raise our HB level. Because at 36 weeks, remember, you are almost term. We are almost delivering. And during delivery, we normally lose blood. We don't, sometimes it can even go to more. At least if we have enough, even after losing, we are not worried. So 10, you need to be on those drugs that normally, we call them hematinics drugs. They normally help us to boost our hemoglobin level. So by 36 weeks with an HB of 10, at least we need to take that medication, also diet-wise. Because there's some foods that normally also help us to have that enough HB in the body. Number one, beetroots zenye most watu wapendangi. Blended inakuanga poa sana. The high leafy greeny vegetables. The terere, the spinach, the mchicha. Some proteins like maragwe. So there's some food that normally help us to at least with that HB. But foods alone can't do. So that's why during your clinic, you normally given those red supplements. They have very importance of that. Because we know during pregnancy, demand of blood is very high. So that HB normally tends to go down. So the reason why we normally give you those supplements is to prevent things like this. An HB of 10, that we normally call it anemia in pregnancy. So at least you need to go to the checkup. At least you'll be given those medication that normally help us with our HB levels. So must one give birth at 40 weeks? It's not a must. That's why we've said the moment you are given that you are, I think each and everybody has an estimated date of delivery. We normally say it EDD. EDD, that is, so EDD, we normally say EDD can be either plus or minus 2 weeks. So 40 weeks minus 2 weeks. So the moment you're 38 weeks, your term. 39 weeks, your term. 40 weeks, your full term. 41, 42 weeks, you know that you're a post-term. Yeah. So you can give birth at 38. So the most recommended is always 38, 39, 40 weeks your full term. So the moment you've reached 41 weeks, it's always advised at least you go to hospital, because 41 weeks is called a post date. Post date. Remember, the moment you've reached 41 weeks, it's a post date. So there's this thing called placenta. Placenta, we normally call it sahani ya mtoto, sindio? So placenta is the connection between the mommy and the baby. So through that placenta, the baby normally get oxygen, the nutrients, and everything that normally helps that baby. So remember, 41 weeks, we are post-term. So sometimes that placenta is always, tunasemanga placenta imechoka. So it might be insufficient for that baby. So that's why you normally say, unaambiwa, mami ukifika 41, utaindusiwa labor. The reason why unaindusiwanga labor ndio kutoa mtoto, cause tukizidi kungoja uchungu, that the placental insufficiency can cause that baby a very big harm. So it depends. The moment it's EDD 40 plus or minus 2 weeks, it's okay. Not that lazima uzae hiyo 40 weeks EDD yako. Kuna wenye wanazaa na 38, kuna wenye wanazaa na 39, kuna wenye wanazaa na 40. So full term, remember EDD, that is 40 weeks plus or minus 2 weeks. Mtu anawezaje jua ball iko na how many weeks after missed period? So with ball iko na how many weeks, that is ni sisi tu ndo tunajonga venye tuna calculate. There's a formula that we normally do. So the moment you've missed your period and unataka ujue ball iko how many weeks, just come to the hospital. Kuna venye kwa tuna calculate. Mostly we normally use the last menstrual period. So we normally use the first day of your last menstrual period to calculate that, to give us the weeks. So for you to know that, you just need to come to the hospital for the calculation to be made. Is it normal to carry, I don't understand, is it normal to carry low from first trimester to last with a small bump? Yes, it depends. Like who have the smallest bump, it's normal. So the most important things, some are normal, some are not normal. Because we have genetic, we have those people who normally tend to just have small bump with small baby, which is okay. But the others are normal. The other ones are not normal. Like with small, you just need to come to the hospital because we rule out. Because with small bumps, we can rule out like some things like intrauterine growth retardation. Sometimes it normally reaches a point where that baby just failed to grow. So the best thing is come to the hospital for checkups to rule out if it's just a small baby by genes or it's things related to like intrauterine growth retardation. Okay. So I was sick while 4 weeks and I was tested for DVT and now on medication until birth. Can it affect the baby? It doesn't affect the baby. Yes. DVT is deep venous thrombosis, where normally say there's a blood clot in the legs. They're normally treated because without treatment, they can even cross to the heart to cause other bad outcome. So the best thing is to be given that drug as prescribed by medication. It doesn't have any effect on your baby. It's very safe. Can one deliver normal after having CS? So normal after having CS, it depends with a lot of things. We normally call it vaginal delivery, VBAC, vaginal birth after cesarean section. It depends with a lot of factors. So it depends, maybe if it's maternal causes, maybe the reason for you going to CS was on your side. Sometimes it can repeat itself. Things like maybe we call it CPD, cephalopelvic disproportion, maybe abnormality of the cervix, things like that. So with CPD, it can't change. It repeats itself. But there is other parameters that we normally look for before we decide you to try vaginal delivery after cesarean section. So it normally depends ni nini likupeleka CS. Sawa. And then pia ita depends na venye mtoto yuko, presentation na a lot of things. So it normally depends. Yes, but you can have a vaginal birth after cesarean section. So this one is always a discussion that you normally at least discuss with your gynecology from 36 weeks, because that is where we normally book, at least we normally made a decision for delivery. But it's possible, but it's also there's some qualification that you normally, if maybe the first baby was vaginal delivery, second baby was a CS, that one is always a first. Umepita hiyo, unaweza jaribu. It depend nini ilifanya huyo mtoto kaenda CS. Kama ni kitu maybe mtoto alikuwa amechoka, maybe alipupukwa tumbo, hizo ni vitu zenye at least unaweza jaribu, but hiyo nayo kwa ina depend na a lot of factors. So always make sure that by 36 weeks where we normally at least tunajua delivery yetu, mnafaa kuongea na daktari wako, at least hapo ndio mna make decision, anakuambia the pros and cons of everything. The other question, can I continue with IFAST even after birth? It doesn't have any effect. Yes, because IFAST iko na iron yenye inatusaidia at least nini. Remember after delivery huwa tunapoteza damu sana. So kama ilibaki, endelea nayo. It doesn't have any effect. So I'm 26 weeks and I was told my baby is underweight. How can someone know? 26 weeks, there's a scan that we normally do. It's called a growth scan. So to be diagnosed with an underweight baby, maybe they did a scan which showed that your baby is underweight. Okay. So the moment the underweight has been diagnosed, there's other tests that or through the tummy. So there's this question. So when does morning sickness start? So we've said so it depends with each and every individual. So most people normally start showing those signs of early pregnancy after implantation that we've said from 3 weeks after fertilization. So there's some people after implantation, within 2 weeks after implantation, the morning sickness normally just start in. For others. Others normally start the morning sickness most probably immediately after the implantation. So it depends with each and every individual. I'm 25 weeks and I've experienced bleeding 2 times now. Is it normal? We've said anything red down there, it's not normal. The moment you see anything, be it bleeding, be it spotting, you need to seek urgent or immediate medical attention. For we've listed, they might be caused. Bleeding can be caused by a lot of things. There is this person that asked about spotting. Normally, some people mtu anakuambianga, spotting early pregnancy, hiyo ni normal. It's not normal. So we've said, yes, spotting can be because of implantation. Spotting can be because of maybe the urinary tract infection, the sexually transmitted infection. Spotting can be because of the change of the cervix. Spotting can be a sign of miscarriage. So the moment you've seen any spot, go to the hospital immediately. Watakurulia out ni ya nini, ni ya gani huko ndani. So spotting is not normal. 25 weeks spotting is a danger sign. You need to seek immediate medical attention. What about diarrhea in pregnancy? It will depend. We've said from 38 weeks and above, that is you're approaching labor. Also, some other people might be having like a loose stool, not necessarily diarrhea. Those are signs of approaching labor. But diarrhea is a danger sign. Diarrhea, just come to the hospital. Maybe we look the cause of that diarrhea. The word diarrhea, it includes a lot. So the moment you diarrhea, kuja hospitali at least uangalie ni nini ina cause hiyo diarrhea.